So today we'll be discussing about the topic, the common surgical positions and what are their advantages and where it is used. So we will see this in this particular video. So hope this will be helpful for you, and has been asked in this has been asked previously in your national exams as well, about the surgical positions shown, or in which operations or in which surgeries this has this position is used, or what are the advantages or disadvantages. So we will see in details. So we will come back to the chart. Before that, let's discuss about the positions and in which surgeries they are used, and then we are going back to the diagram, so you will have a brief idea about the positions, right? So first is our concept. First is our supine position. This supine position. Second is our supine position is for majority of surgeries. Questions are always asked from the exceptions, right? So then is our lithotomy position. So lithotomy position is mainly for gynae surgeries. You know that apart from gynae surgeries, there is another surgery, it's hemorrhoid surgery. So these two are the surgeries where lithotomy position is used, and the question asked where the most common nerve injured in this position is your common peroneal nerve. I repeat, common peroneal nerve, important. So lithotomy position is used in your gynae surgery or hemorrhoid surgery, and most common nerve injured is your common peroneal nerve, right? Talking about your next position is our lateral position. So lateral position is used in two surgeries, thoracotomy and in anal surgeries. Okay, and here the most common complication is your brachial plexus injury, right? Brachial plexus injury. We will move to our next position, which is your jackknife position. Jackknife position. This is obsolete now, right? Obsolete now because this is not performed nowadays because of what? Positional asphyxia has been asked. Positional asphyxia. So this position is not used nowadays. Next is your prone position, right? This is for spinal surgery mainly. Next is your sitting position or Fowler's position. Now this one is for your mainly CNS surgery. CNS means central nervous system surgery, or you can say posterior fossa surgeries. But there is a risk in it, and this is where the question is asked. There is increased risk for air embolism in this particular position. Increased risk for air embolism, very important, right? Now next position is your Lloyd Davis. One second. Lloyd Davis. So Lloyd Davis position is for perineal procedures, right? Perineal procedures. This is your combination of lithotomy plus Trendelenburg. So Lloyd Davis is your combination of lithotomy plus Trendelenburg, and this is mainly for perineal procedures. What is Trendelenburg position? I will show you in the this one in the slide above, right? Then there is reverse Trendelenburg. Reverse Trendelenburg. This is important. This is used for lap chole. This has been asked. So we will revise once, and then we will go back to the image, right? So that you will never forget, right? See, First I have discussed supine for maximum surgeries. Then there is lithotomy for gynae surgery, hemorrhoid surgery, and here common peroneal nerve is most commonly injured. Lateral position for thoracotomy, anal procedures, and here brachial plexus is commonly injured. Jackknife is an obsolete now because of positional asphyxia. Prone position for spinal surgery, seating or Fowler's for CNS or posterior fossa surgery, but here there is increased risk for air embolism. Lloyd Davis for perineal procedures, it is a combination of lithotomy and Trendelenburg, we will see that, and reverse Trendelenburg position for lap poly. It has been asked, right? So now we will see the image. Yes, I hope it is visible. So this is your supine position. One second. This is your supine position, right? This is your prone position, and we have discussed that. Now see, this is your Trendelenburg position, which is your this is your Trendelenburg, and this is your reverse Trendelenburg, which is used for lap collie. We discussed reverse Trendelenburg, right? And then this is your lithotomy position. This is your Fowler's. This is for CNS and posterior fossa surgeries. There is increases for air embolism. This is your jackknife position. This is your knee chest position. This is your lateral position for thoracotomy, and this is your kidney position, right? So we have we saw all the all positions and their advantage, disadvantage, their risks, the most important salient points. So hope you will not make any mistake from this video, and we will meet in another video, right? Thank you.